The Merriam-Webster Dictionary has defined a Caesarean section as a surgical procedure involving incision on the abdomen and uterus for delivery of offspring. A C-section has many different reasons and risks, and one specific procedure that varies. Today I will be informing you on the reasons, risks, and precautions taken during a C-section. Medical News Today has said that 31.9% of births in the United States are C-sections. Some of these C-sections are due to the request of the mother, but the majority of C-sections are because the mother will need a C-section in order to give birth to the baby safely. The Medical News Today has also said that 2.5% of C-sections are out of request from the mother. C-sections are becoming more common every single year, and it's important to understand the different factors that go into a C-section. The American Pregnancy Association has said that a woman who has had a previous C-section for a birth has a 90% chance of giving birth by C-section again. This is one of many reasons that a woman would need a C-section. Some other reasons are that the labor is not progressing, the mother is holding more than one child, the baby's head is not face down, and the baby has a low heart rate. Another reason is that the baby is too large to travel through the birth canal, or the mother's pelvis is too small to deliver the baby. If the mother has a contagious disease that could be transferred to the baby if born vaginally, a C-section will be needed. There's also a cord prolapse that can happen. This is when the umbilical cord falls into the cervix before the baby is born. If this happens, it will cause for an emergency C-section. Also, the placenta could possibly cover the cervix. If this happens, this will stop all the oxygen that goes to the baby, and they will need to have a C-section immediately. Even though C-sections can prevent different birthing hazards, they have many potential risks. These risks apply to both the baby and the mother. The mother risks are of uterus and abdominal infection of where the incision was made. The mother can also get blood loss, blood clots, or a postpartum hemorrhage. The baby has fewer risks than the mother, but they are still just as important. The baby could possibly have breathing problems. This can be observed if the baby has abnormal rapid breathing within the first few days of birth. The baby can also have accidental cuts due to the delivery process. And with these risks, the procedure has many precautions for the mother. The mother's view will be blocked the entire time in order to reduce the stress that she will be in. The mother will also receive an epidural or spinal anesthesia. Once the medicine is given, the procedure will begin. The procedure begins with the abdominal cut. There are two different types of abdominal cuts. There is the bikini cut and the classical cut. The bikini cut is on the lower part of the abdomen, and it's a horizontal cut that goes from side to side and is just above the pubic hairline. There's also the classical cut, which starts just below the belly button and goes horizontally down to the top of the bikini line. These cuts are from 10 to 20 centimeters deep. Then once the abdominal cut is performed, the uterus cut will be performed afterwards. There are two different types of uterine cuts. The uterine cut depends on the cut that was used for the abdomen. If the bikini cut was used, a low transverse uterine incision will be used on the uterus. That is a side-to-side cut on the lower part of the uterus. If the classical cut was used, the bikini cut will be used on the uterus. This cut can also be changed due to where the baby's head is placed inside the uterus or what the doctor deems appropriate for the incision. Once the uterus is cut, it will break the protective membrane that is covering the baby. Once the protective membrane is cut, the baby will be delivered. The baby will be pulled out from the different layers, the umbilical cord will be cut, and the placenta will be removed from the uterus. During the procedure, the mother may feel a pulling, tugging, or pressure sensation, but will remain ultimately pain-free. In conclusion, C-sections are caused by many different things and can be because of the request of the mother. They also have many risks that apply to both the mother and the baby. The procedure depends on the incisions on the abdomen and uterus. During this process, medical professionals make sure that the mother is comfortable and is well taken care of. The C-section has many different reasons, risks, and ultimately has one specific procedure that can vary. It is very essential to know the different elements that go into a C-section in today's age due to the rise in popularity. Thank you.